As we gather, we are reminded that the town of Bonnyville is situated on Treaty 6 land that is steeped in rich Indigenous history and is the traditional homeland and home to First Nation and Métis people today. We respect the histories, languages, and cultures of First Nation, Métis, and all First People of Canada whose presence continues to enrich our community. Council, before us, we have an agenda. Are there any changes to the agenda?
Nothing from administration, Madam Mayor.
Okay, looking for a motion to approve. Councillor Blanchette,
I'll move adoption of the agenda as presented.
all in favor? Carried. Thank you. Okay, so we are here this afternoon to hear from many different delegations, organizations that the town does support. I want to thank everybody for joining us today. The process will be, we'll have you come up. We have about 20 minutes, 30 minutes allotted for a presentation and then question and answer period. It's very much an opportunity for us to learn more about your organization, some of the things that you've achieved throughout the year, and then on the financial side, you know, what are your asks and where you're going. So we're very much looking forward to speaking to each and every one of you, and I appreciate you being here today. So we will start with the Bonnyville Health Foundation. So when you do come up, we do have a microphone, if you don't mind just using that when you come on to your presentation. So Dawn, we will give you the floor.
Thank you, Mayor and councillors. For the benefit of the gallery, I'll introduce myself, Dawn Weber, the Executive Director for the Bonnyville Health Foundation. And a little bit of a summary of the foundation. As most of you are well aware, the Bonnyville Health Foundation is a registered charity that operates under the Hospitals Act. So we are the fundraising arm for our hospital. We raise money for our area of greatest need, which includes purchases of state-of-the-art equipment for our hospital, anything that is a transformation or enhancement by way of equipment and programs, palliative care fund, long-term care fund for seniors, mental health fund for local mental health initiatives, and I feel like, oh, the Bonnyville Cancer Clinic. That's an important one too. So to start off, I want to say thank you to those from council that were able to make it to our ribbon cutting of our Wall of Gratitude last week. It was very inspiring for me personally to see so many of our elected officials from the region with us. We didn't receive any RSVPs for that small event, and it was a real surprise when we wheeled up with our cake and had a full room of people there to support us and to acknowledge the many donations in the last year to our foundation. So thank you for that. I also want to tell you about our upcoming event on October 2nd. That is our first time hosting the Women in Wellness After Hours conference. We're loosely using the word conference. It's not really a conference, but we're going to have a panel discussion with women's health in mind, with 2 doctors and 1 psychologist, addressing a lot of the taboo topics surrounding women's health, and to try to reassure women in our community that they're not alone in a lot of the things they're going through in the different seasons of life. This will be our first ever friend-raiser event. We will not have any fundraising elements at this event. And it's to show the community that although we are the fundraising arm for the hospital, we are also advocates for wellness. And we want to be a resource to the community to help them know where to turn when they have concerns with their health. And we'll be hosting that at the Strathcona Performing Arts Theatre. And we're really excited for that partnership and to be working with them as well. So I guess I will move to the slide that's up. And this is our 2025 gala results, but it's really our annual results from last year. So the way that our process works with the foundation is that our hospital site administrator and management team bring us their wish list in the form of grant applications every June. And we have a meeting in June where the board vets the applications and looks at the funding that we have on hand and makes approvals based on the needs of the community as stewards of the donor dollars. So we had a record year this past June. The board approved $603,104.35 in funding for new equipment and programming. In addition, we also approved $18,600 as an investment from a grant application we received from Covenant Foundation. And so this is a collaborative project that we're teaming up with the mothership of Covenant, essentially, to share the cost on mobile simulation training that will come to Bonnyville for our staff. It's a really cool training program. We actually got to see it firsthand in Edmonton. They will utilize local actors if they can find them, and they will literally simulate situations for the nurses to practice procedures in a real life type of setting. Plus, they have very high-tech mannequins that they use as well. So that $18,000 investment, we felt that it was a great investment and approved it immediately, but also one of our corporate partners thought it was a great investment too, and we've had the cost completely covered by corporate sponsorship. So that was very exciting for us. As far as our list goes on this list, I just wanted to share some of the items that we approved this year that we found particularly exciting. The high-end wheelchairs that we're getting in, we are bringing in 6 off the hop. We're hoping to bring another 6 in within the year. So the way that the list works is I usually get a wish list that's well over what we actually have on hand. So we will approve what we can and then keep the remainder as a working wish list so that I can seek sponsorships and funding to fund the remaining items on the list. So we're bringing in 6 to start. These are wheelchairs that I believe assist in lifting the patient out of the chair, which helps alleviate backs and muscles of our staff. A new Lucas chest compression system, which we currently share with the ambulance. So the hospital will have one of their own to make things a little more speedy with that. A pocket ultrasound for cancer patients in our clinic. It's a really cool, tiny little ultrasound that finds the veins and makes things really easy for therapy treatments for cancer patients. Phototherapy for newborns, which is for babies with jaundice. The wig lending library that we're setting up, it's a small request, but we're really excited about it. And as I know some of you know, my mother had cancer 3 times before she lost her battle, and she had a beautiful wig in her final journey with cancer, and I'm really proud of this one. The hysterectomy equipment, it's very expensive, but it's very high tech. Currently, our hospital is performing about 100 hysterectomies a year, and they're going to be able to increase that with this new equipment, specifically laparoscopic hysterectomies. The sonocyte ultrasound with cardiac probes, also a really high-tech ultrasound system, and the probes can ultrasound right into the heart. So again, something that we did not have that patients might have been transported to Edmonton for will now be in Bonnyville. Air beds added to long-term care, which we have purchased on a regular basis, and then the portable bathing system for immobile and palliative patients. Also just a really fantastic upgrade to patients that can't easily get out of bed for hygiene purposes. This is almost like a pool that slides under the patient and has a system that suctions the water, and it's a much more dignified way to bathe patients, and we always want to show as much dignity to our seniors as possible. Okay, moving on to our gala. So this is our first announcement of our theme. We have not gone public with this, so congratulations to the gallery for getting to be in on this. Charity, not Charlie, Charity and the Chocolate Factory is going to be our theme for 2026. We are going to pull off an epic theatrical theme for you once again that will be filled with sweet treats. So we're really looking forward to planning this. We already have some sponsors lined up because it's an exciting event to be a part of. And our request to you this year is to join us as presenting sponsor again for that $25,000. The next slide shows the presenting sponsor package that we have for your recognition, which is not listed in the sponsorship brochure that you have in your hands. because we use the brochure to advertise to sponsors that you are the presenter of this event. So everything is pretty well the same as last year, and I hope you were happy with your recognition last year. The only thing that's been updated is our new wall of gratitude. So that has been added to your recognition piece as well. The next slide is coming news and goals. So for coming news, I know last year I had touched on the possibility of us working on a project to raise money for a CT scanner. And that is a very long-going project, but we have received news that it's been approved on the levels of Covenant Health. So we are now waiting for the provincial government to give us their green light for that project. This is a very expensive project for the foundation to take on because we essentially have said we will take on both the cost of the CT and the cost of the renovation if it's approved. There's a lot of physicians that want this and they're keen on it being a recruitment piece for bringing in new physicians. And so we are willing and up to the task to bring in the funds needed for it. So I will keep council up to date on progress that's made with that. And there's one more little news that I want to share that's sort of pending right now, but it's looking really promising. And that is that the Bonnyville Health Foundation is in the works of becoming a funding partner to the Child and Adolescent Mental Health Collaborative. They are looking at taking an office in the hospital to practice out of, and that puts them in the block of being under the Hospitals Act for our charity. So with that new partnership that we hope to see come through, it will also open up the foundation to be a vessel to receive donations for child and adolescent mental health. So we're specifically for their program. So we're really excited about that opportunity. Lastly, I just want to say that after the last municipal election, it was 2 months later that I joined the foundation. So I just want to say thank you for being a part of my journey for the last 4 years. And I hope to see all of your faces again in the future. But if this is the last time all of us are together, I want to say thank you for all the support that you've shown the foundation and to me personally.
Oh, thank you so much, Dawn. Appreciate that. Thank you for your presentation. I will open it up to council for any questions or comments for the Health Foundation. Anything from this side? Councillor Kushner?
I'll start. Thanks, Madam Mayor.
Mhm.
Actually, it's more of a comment. A portable bathing system for immobile. I don't think people realize how important that is. My stepdaughter, her father-in-law just passed away, but when he was in Edmonton, he hadn't had a bath in like 2 weeks. And he actually got his wife to come pick him up to get out of the hospital. That's how horrible that is not to have that thing. So for us to have that here, kudos to you guys, right? Because it makes patients' lives tolerable in a place that a lot of times is not tolerable. So I think that's, out of all the things I've seen here, which are incredible things, to me that one hits me right in the heart, just like the wigs for you. So
Thanks
thank
for
you.
sharing. Mhm.
Thank you. Okay, I do have a few questions. Can you talk a little bit about, so you said in June is when you get a list of requests, right? This probably comes through from the hospital administrator, I would think. I'm not entirely sure.
Mhm.
But can you talk us through how that process works? Who makes the decisions? You said it comes to your board. Is the administrator, is the chief medical officer there? Maybe if you can just walk us through that, I'd
Sure.
appreciate it.
The process actually begins in January. So we have our first meeting in January with the site administrator to give her an overview of what funds we already have on hand and what we're projecting for our gala to bring in, so that she has an idea of what to realistically stay within for the requests. The management teams all send their applications through her, and she kind of vets them to make sure that they don't fall under operational budget before they come to the foundation. In February, I meet with the physicians specifically to discuss their wish list with them and to make sure that they feel approachable to the foundation to ask us if something meets the criteria as well. And in March, I meet with each manager of every department individually just to have a little coffee talk and say, you know, don't forget, if you've been wishing for something, don't forget about us, because that's what we're here for. We're your piggy bank. And then in May, we get the applications, and that's where I deep delve into research and start printing off photos of what a Broda chair is and what a sonocyte ultrasound is. And then I can prepare the recommendations, maybe similar to how administration does for the town, but I prepare recommendations to the board on what I see that we have in our funds and what I think, what I would recommend that is approved versus staying on a list that I feel I could find in sponsorships later. And then all of them are presented, we used to do them all one by one, but some of them are, for lack of a better term, easy yeses. So we don't need like a full out presentation for some of the asks, but for the new items and items that we kind of want clarification on how many patients will be impacted by this purchase, we'll have a full presentation in June at our board meeting. And then, so at that meeting, we have our site administrator attends. Any department managers are invited that want to advocate for the asks for their department. The medical director, Dr. Hansen, attends, and he provides his feedback on what he feels on that list should not be necessarily donor dollars. And then we also will invite extra guests. So this year we had someone from the collaborative came, and we also had a physician that works with the collaborative come to advocate. So we want that advocacy piece at that meeting. Like, we want them to kind of fight for the dollars that they're asking for and give us a really strong case. And then ultimately, then the decision goes just to the board, and their decision is based on what they feel will make the donors most proud.
Yeah, I think that's good. Thank you. That's really good feedback, because I think it gets lost a little bit. There has been a notion in the past that money raised goes to buy equipment that doesn't stay at our local hospital. And I think it's important for people to understand the whole process and how it is determined on what is purchased, and that it actually stays at our hospital. So thank you. So moving on, you said you guys were talking about supporting the Child and Mental Health Collaborative. Once they move into the hospital, it gives you that opportunity. The dollars that you would be able to fund them, can that go towards operating? Or is it like for capital? Do you know?
It can.
Okay.
Yes.
Okay. Okay. I think those were my two main questions. But on the mobile simulation training, if anybody here watches Amazing Race Canada, one of the challenges, they had to use one of those, and it is absolutely incredible. So you haven't, go on demand and watch that episode. It's a super cool thing. Yeah, technology. So no other questions. Thank you so much. Oh, Councillor McAvoy.
Just as you were talking there, it came to my mind, you're purchasing this equipment. Does the foundation also fund the maintenance and upkeep of this equipment, or does, once you've purchased it, it becomes part of Covenant's funding to maintain it?
That's a great question. And it's one of the questions on the grant application is, how do you plan to maintain this equipment? So yes, most pieces of equipment, it's a requirement that they are maintaining it and are funding the staff to use it. In the case of the CT scanner, I have a feeling that that's going to be negotiated. So they may look to the foundation to contribute toward maintenance and staffing. So those will be big pieces in determining whether or not it's a project the foundation can take on.
Okay, thank you.
Yep.
Thank you so much for your time today. I really appreciate your presentation.
Thank you.
Thanks. Okay, next up, the Child and Adolescent Mental Health Collaboration.
Hello, everyone.
Oh, good afternoon. Welcome. Thanks for joining us.
Thank you. I'm all hopped up on sugar from the mocktails outside, so I'm
Alright.
ready to go.
Maybe you pick it.
For those of you who don't know, I'm Kendra Krankowski, the Mental Health Navigator with our Child and Adolescent Mental Health Collaborative. This is Callie Ellis, our Administrative Assistant for the Bonnyville Primary Care Network, which is one of the governing agencies in terms of operations for the program. We have been, I think, at this desk many times since 2016 now. And so the aim of the collaborative is to increase collaboration amongst agencies and partners that support mental health of students and families in our community. This is to improve access to mental health supports, services, and improve symptom management, increase mental health knowledge within our community and our Lakeland area. Just history, like I mentioned, the collaborative commenced in 2016, led by the charge of one of our local nurse practitioners, Chantel Valley, and then brought in care of some of our physicians with the Bonnyville Medical Clinic and the Bonnyville PCN and Covenant Health at that time, and Alberta Health Services, as it was known then, is now Recovery Alberta. So all of our physicians that are attached to our program are trained in a program called CanReach, which is a general physician, nurse practitioner program that helps with them understanding and managing treatment of ADHD, anxiety, and depression. Those are our 3 mandates of services that our physicians support within our clinic. And then previously for financial support in terms of operations and continued levels of services and supports for our community, financial support has historically been through Alberta Health Services, Recovery Alberta, the town of Bonnyville, and the MD of Bonnyville. We have a few little pockets of funding that were, and you'll see from like Festival of Trees, that helped us gain access to educational psychological assessments for families and other small things that families may not have been able to afford themselves or privately. But just currently in this last fiscal term, Recovery Alberta has decided to remove their funding in contribution to our program, which typically was around $67,000, which was for our mental health navigator's role and position within the program. Gaps that our program fills, so a big one is that we're decreasing emergency visits and walk-in appointments for our local health facilities. The other, being that our program is for anyone that uses Bonnyville Medical Clinic as their primary medical home base, a lot of our patients are unattached patients that do not have a family physician or a family nurse practitioner within our area. So the hope is that we're actually decreasing the wait times that they would be seen or assessed or monitored in terms of their treatment of ADHD, anxiety, and depression. And then again, that step of medication management. If a family or a student or a young person is started on medication, that medication is well monitored within our program, which if they are an unattached patient would have to be used through walk-in services, which they would have to initiate on their own without the support and backing of the clinic behind them to follow up that care. This is just a breakdown of our collaborative team. So currently we have 2 physicians and 1 nurse practitioner part of the program, a mental health navigator. Previously, the mental health therapist, the child mental health therapist from Recovery Alberta was part of that collaborative team in attending our Tuesday clinic. That went alongside with the funding that they also contributed back at the end, at the beginning of this year, end of fiscal last year. So we no longer have that mental health therapist directly connected to our clinic. They have agreed to have direct referral directory from the navigator. However, it is still now a waiting process now to get them in for intake on that level where we had direct communication before. And then within that funding, we operated quite lean on the budget that we used, in particular that we were also able to hire a family wellness advisor, which is also a social worker to us. And the loss of that funding also meant loss of that position as well. So we have reached out to community partners in terms of the Lakeland Family Resource Network, in terms of our parenting support piece. So a big part of connecting our families is giving them the supports needed for parenting family dynamics within their home, not just in school and not just in their medical care. So they have agreed to move alongside us in collaboration as part of this work to provide parenting support on the lens that our family wellness advisor no longer is able to provide. And the other obviously collaborative partners are the Bonnyville Primary Care Network, the 3 local school divisions, the town of Bonnyville, MD of Bonnyville, now the Lakeland Family Resource Network, and Recovery Alberta previously. Referral criteria for us, so we manage cases within ages of 6 to 17, again, that they follow that Bonnyville Medical Clinic as their home base of care, and that they have either diagnosed already or suspected diagnoses of the ADHD, anxiety, and depression characteristics, and that they do have to have some willingness in their family supports to kind of move forward with us in increasing natural supports and strategies and helping their child feel the best that they could possibly feel. Since 2016, we've had over 800 referrals to the program. That may either be through mental health navigation of community supports or clinical assessment. We actively hold a caseload right now of 60 families, and now that's just right now. This number goes up and down depending on the referral season. New school year, this will more than likely go up here in the next few months with the new school start. And then just as of January 25 to August, we have had we've had already 33 referrals just for this past calendar year. Just a quick glimpse of historical stats for us. We really wanted to show, people say that this doesn't look good because our numbers have went down. We would challenge that and say we've actually kind of curbed a need in our community to a certain degree that now our referrals are way less because we've already managed a wide variety of the population within our community to help manage their symptoms or concerns. So we would challenge that just because the numbers are going down doesn't mean we're not providing the same supports. I think we've actually managed to lower emergency visit rates and lower symptoms within our community of those 3 diagnoses. So like I said, typically we hold our caseload around 60 to 70 families at a time. Reasons again why the statistical changes, when we went through COVID, the whole entire program needed to move virtual, which impacted supports that we were able to give a little bit as well. Physician retention, another problem that I know we're experiencing across levels of senior care, all general population in our community. But our physicians, we went from having 6 physicians of CanEach trained accessible to the program to now 3. And over the last 2 years, we've had some staff turnover, which means building more relationships and collaborative partners and not relying just on a person, and more so those relationships within the collaborative. And then with many of our families, we keep them on caseload because of that lack of family practitioner or primary care support. So we're ending to keep cases a lot longer than we would if we were assessing, stabilizing, and discharging back to primary care, but because their primary care is walk-in. And we're talking about our young kids of 6 and 7 years old sometimes, where we're just not confident that we would like them to be off on their own in their own primary care journey. So we hold on to them within our caseload a lot longer than we probably should, necessarily for monitoring of care of our mandate. So what we're here obviously to discuss today. So we've had and we've tried many kind of funding conversations over this last year since Recovery Alberta has addressed their decline of funds. And so we have had conversations with Covenant Health directly. We have not heard anything from them directly at Covenant Health's level quite as of yet, but that's not saying that information isn't to come. We just haven't heard anything directly from them. That was in June. So we are still hopeful that there's conversations at higher ends that are coming through to us, which led us also then to presenting for as you heard, the Bonnyville Health Foundation. I will say we are in active conversations right now just to address the moving of the program to the hospital. That is kind of just a conversation that still needs to be had because the hospital, as you know, in terms of space and location, doesn't have a lot. So our executive director just had a baby. So she's just having a little time before those negotiations will be finalized, but it's still something that the Bonnyville Health Foundation has to address in terms of space for our program to be able to facilitate it there. So just to make sure. Yeah, because we currently have space in kind with the Hive. So that would increase dollars that we would still need to operate the program in terms of rent of facility space if that wasn't within the negotiations. We had presented to you guys previously when we had asked for an increase of funds from last fiscal year. We have went through our MLA and up to the Ministry of Mental Health to discuss our concerns and why funding has been taken back. Unfortunately, our letter was a polite letter of that unfortunately we don't meet the mandate of the mental health initiatives moving forward right now in terms of recovery and addictions. We do sit in a program more in prevention, early intervention care, but that's to say that it doesn't get to those points. So unfortunately, that's where we were left with the Ministry of Mental Health letter. And then for those of you who don't know, Primary Care Alberta is also transitioning into their regionalized corridors, and that they are also kind of changing how they operate and how many executive directors and positions there'll be in terms of our primary care networks within our region. So that is also kind of now a pending conversation until we know exactly what those funding structures will look like and executive director positions will look like. Like I had mentioned previously, those funding supplements came from the town of Bonnyville, the MD, Recovery Alberta, and then a small pot of Festival of Trees money that has now been utilized up as of last year, I believe, right? We used the last bit of that
Yeah, there
funding.
might be like a tiny bit, so we just need to figure out
Yeah.
how we can spend that small amount on
Yeah.
those specific items.
And so specifically, those were for direct family payments of psychological assessment primarily, or family counseling if we had a family that needed direct support in terms of their home dynamic. Just some typical highlights for our financials. Our program requires approximately $130,000 a year to operate. I believe this is without rent because of the Hive location as well right now, offering that space in kind. And then currently, the town and the MD have provided financial assistance. It was $25,000 for our first 5 years, I think. And then 2 years ago increased to 50, and last year we asked for another 25,000 because we were not going to be able to be operational past that. As of today, obviously, we don't have a secured pot of funding. There's conversations, but so we are going to ask for another 75 to secure that funding piece from the town today. However, we know and we would keep you updated as to the conversations with the Bonnyville Health Foundation moving forward, because that will be in the near future for sure on where that will be. And then if none of those things happen for us, the program, unfortunately, as of March 31st of 2026 will no longer be able to be operational. So that is kind of where we are financially, but that's all we have for you today.
A note to end on. Council, thank you. Thank you very much for that. And council, any questions or comments? This time? No? Councillor Sharon.
Yes, thank you, Madam Mayor. Thank you, Kendra and Callie, for advocating for such an important, needed service in our community. And my heart goes out to you, and I'm sure on behalf of the mayor and council for all the advocacy you guys are doing, all the changes the PCN and the Hive has gone through in the last year. Just a quick question. Has Hearts for Healthcare out of Coal Lake reached out to you in collaboration and some possible funding?
Yeah, so we have had some conversations. Basically, it was kind of directed as if the Bonnyville Health Foundation wasn't in, that Hearts for Healthcare would be another conversation to be had for financial opportunity with them. They did want Bonnyville's Health Foundation to, obviously we are supporting Bonnyville, so they sit more definitely in Cold Lake, but they do provide supports around the Lakeland. So there has been conversations with them as well. They wanted to see where Bonnyville Health Foundation sat with first before that conversation was kind of moved into negotiation.
Okay, thank you.
You're welcome.
Any other questions? Councillor Kushner.
Thanks, Madam Mayor. So you're asking for 75,000 from the town of Bonnyville. It's about 130,000 to operate this annually. Are you going to be asking that from the MD as well?
Yes.
So, because your numbers are probably very like 50-50, somewhere in that range, I would imagine.
Yeah, so if we're not looking at Bonnyville Health Foundation, the full supplement, we would be asking from the town and the MD to move us forward to continue to try and find another financial avenue.
Right. Okay. Yeah, and that'll just give you 10% variance there. So that's
Yeah.
okay. I got it. Thank you.
Thanks. I couple questions. Do you ever get any phone calls or try to, do other outside organizations try to refer patients? I know we've built this ecosystem for patients here in Bonnyville, but just out of curiosity, do you get calls from outside of Bonnyville? for
Yes.
patients?
Yeah, being the navigator position, a big part of my role is navigating supports even when they don't meet necessarily clinical assessment mandate for the collaborative. So we do have a lot of calls around from Elk Point, St. Paul. Kihiwan is in kind of within our mandate, but depending on where their medical home base is, can be tricky sometimes. But yes, primarily Cold Lake. Cold Lake is obviously also seeking child mental health support as well. With us only having 3 physicians in an operating framework, I'll say, we just would not be able to open that up at this time because of the lack of physicians we have. I think previously we had mentioned to you, we had applied for the Federal Mental Health Youth Fund grant, and we kind of proposed that there would be this encompassed team that we would be able to open to an entire lakeland to provide supports across our lakeland, but that would mean more staff to be able to do that. But yes, I get many calls outside of our region. I think the farthest one I've done this past year is Smoky Lake.
Have you heard from that grant funding yet?
Pardon?
Did you hear about that grant?
There
application
was a
yet?
first round of funding dedicated out that we did not meet their, or we didn't get picked.
Yeah.
They did say there was a second round, but I believe that comes
The big
October.
funding is
Yeah.
gone.
Yeah, and I believe they come with a second round come October.
And then secondly, okay, so we're saying, or the GOA is saying we don't fall under Recovery Alberta. It's mainly under preventative care. Do you have any ideas or any creative ideas that maybe you can share with us that we can help advocate? Maybe if it doesn't fall under Recovery Alberta, where else could we be looking to advocate for you?
Prior to June, we had discussed going the avenue of the Ministry of Education and looking at, because when we first started in 2016, actually a part of that funding was the RCSD funding from the Ministry of Education that went to Recovery Alberta for that mental health therapist position. So we've kind of thought, do we maybe go back the education route? Obviously, with decrease in funds and everything they're going through right now, it's probably not the first step that we would probably go down now. And our MLA had also suggested that maybe we have conversations with just the Ministry of Health in general, and potentially go down that route and not specifically mental health. The problem we run into every time is we're such a specific niche bit of service. That does it typically fall under health? Well, not really. Yes, the prevention lens, but we're primary mental health. So that's where we run into a lot of our problems in applying for funding or advocating for ourselves, is because we're such a small niche. We consider it a grander scale of things, but because we're specific on that ADHD, anxiety, and depression in the age range, it becomes a very specific niche of service.
I did attend some of the regionalization meetings over the past year, and people that are now Primary Care Alberta have heard of our program. So they're hearing about us, they're interested in what we're doing. Our executive director, Jesse, and our physician lead, Dean Hansen, are working to convince Primary Care Alberta to help support us. So
We're trying all the routes, or routes, I should say.
We'll try as much as we can with our efforts and we are with other ministers. Hopefully we can, somewhere navigate it. I mean, doesn't matter which way you're spinning it. I mean, in the end, we're just trying to help.
Yeah.
Okay, I think that's all. Thank you so much for your time
Thank
today.
you.
Appreciate
Thank
it.
you.
Okay, next up, the Clayton Bellamy Foundation for the Arts.
Good afternoon.
Welcome.
Honorable Mayor, councilors, thank you so much for having us here this afternoon to speak to you about the Clayton Bellamy Foundation for the Arts and the Bonnyville Strathcona Performing Arts Center. We wanted to thank you, first of all, before we start, for taking part in and being a supporter of the 3rd annual Clayton Bellamy Foundation Gala and Golf. I wasn't able to attend, but I heard it was great. But we are very grateful for your help and support. It helped us raise $140,000 this year, which is better than we had projected for our 3rd year of doing this event. So we're very grateful for everything that you've done to help and continue to support this project in the community. We are coming to you today to request $45,000 for operating expenses for the theater to continue our quest at self-sufficiency. We are using, pretty much right now, every penny that we make is going to the overhead that exists on the theater, which is just under $650,000. So we've currently completed a dozen shows in the theater, more than was actually suggested to us by other theater operations. They said that we should start out with, I believe 6 is what they said that we should do in the first year. So we've completed 12 and we already have, and we're only halfway through the first season of shows. We have, I think, 6 maybe in October alone.
We have 7 in October.
Yeah, so we have a busy year and we still have no theater manager. And that's largely due to having the money to pay a theater manager. And it's also been very difficult trying to find someone capable of the job. Typically, these jobs are $100,000 plus a year operations. People come from the cities to the small towns to do these theater jobs, and we don't have the budget to pay them. But that is our motivation to get a theater manager and to increase, obviously, the money that's coming into the theater so that we can make it a self-sufficient operation once we have the theater paid off. Another struggle that we are confronted by is that not being open for over a year, a lot of the grants that we are eligible for, we can't apply for until we've shown a year in actual business, or sometimes 2 years in actual business. So a couple of those being the Alberta Foundation for the Arts, we've wanted to apply for, and that is one of them is an arts presenting project that will reimburse a portion of the fees that we put out to pay for artists and for entertainment. They'll reimburse that for the following year. So, and the other one is the Alberta Foundation for the Arts Operation Grants. So obviously to help pay our day-to-day bills. And, but we are applying to, every other grant under the sun that we can get our hands on, including the Music Counts grant, which is a $20,000 grant for equipment and instruments. So we're hoping that we can qualify for that this year to, again, help offset any kind of, we're still, in need of certain equipment. We have many wish lists, and that would go towards that and help hopefully offset our budget where we don't have to spend. So I believe you have a copy of our budget in front of you, just showing kind of where we're at and where our shortfalls are. And with the $45,000 operating grant, or sorry, not grants, but with the $45,000 from the town, we would still be 2,000 and some, I believe, in the red. But this would go to helping us keep continuing to pay off our overhead for the building of the theater as much as we can to get that, our loan to the town and the school and everyone else paid down in proper time, as well as, keep the operation. At this point, you're looking at the 3 people who are also running the theater, and all our volunteers, which are, it is a full-time job on top of our full-time job. So it's pressing, I think, for the continuation and continued success of this theater, for us to have someone who's the upfront operations manager, so that we don't all fall apart at the seams and then we're really scrambling. So Our sanity is holding on by a thread, but we're still there. Did anyone have any questions?
Any questions?
We have reached out to the MD as well for money for this same, for the same reason, for operations. So we're hoping that we can get the support of the town to help us get through these first growing years.
Okay, this position, is this like a full-time position? I don't really understand. It's a new world for me, or is it something that's part-time based on just events, or is this?
Yeah,
Or-
it would be
How does that work?
currently a part-time position where some of the work that can be done at home, whereas we need someone who's consistently at every event, who is spearheading the organization of the volunteers, of the till, of the, you know, the food and beverage, and as well as presenting all our upcoming shows. So basically you need to open and, you know, be the first feet in and the last ones out at every event that we have, including keeping track of all of our promotions for every show, how ticket sales are running, interacting with managers and promoters and bands. It is a lot.
If I could speak to that. It is, I mean, like what Clayton was saying, it's probably more of 3/4 time when you take all that into account. But also over and above that, there's grant writing. And there's, you know, trying to get the support of local businesses to any of our programming. For example, right now, we just have the Bonnyville Friendship Center, who has wonderfully stepped up to promote an Indigenous play that's going to be at the theater October 9th. And it's a beautiful play about Métis culture called Where Have All the Buffalo Gone? And so I would like to, you know, that position would also be in charge of sales, to be able to get sponsorship, as other theaters do. You know, we actually really go to the Camrose manager to look for a lot of our inspiration as to how they run their theater. And that is one of the things that they do successfully is to be able to sell to businesses the sponsorship opportunities and then have it in a catalog, which also would help to offset our costs and bring in money. And that, when you put it all together, is a full-time job. Yeah.
I would like to at least touch on it, just, you know, maybe advocate for some of our successes that we've had just in these short months. We've employed a full-time theater engineer. We have a student who is working as well, being mentored in the theater in sound and lights. We've brought Ukrainian dancers, Indigenous plays, French. We have a French band coming in from Quebec. So we are hitting all our marks with the things. We have our second ballet is coming to the theater here in October, as well as the Nutcracker in December.
And an opera.
Oh yeah, and we're going to have an opera. So in June. So we're very pleased to see that, you know, the things that we set out to do are coming to fruition. You know, we're reaching out, and we've again given a third bursary to another student to go to secondary education in the arts, thanks to everyone here. So these are the things that, you know, the metrics that we want to move in the community. It's not just about going to see a band. It's bigger than that. It's about connecting our community at its roots. And I get worked up about it because I can't stress it enough that this is the fiber that holds us together in the times that are the hardest. And this place is going to be and is the heartbeat of the community. And we really appreciate your support.
Yes, very passionate. And my other question was going to be, but I think through your, you know, what you're presenting us has already answered it. I was going to ask if there was an opportunity to work with the school. I don't know what the relationship is there to help on the operation side, but I think you're building something bigger for the community that I don't know.
We
Has
do
it
have
been
a
consideration.
We do have a meeting with them upcoming as well to discuss our demand loan with them. So as part of that, we're hoping that perhaps they would maybe forgive some of that now that the building is finished and we can see, you know, what the value it has done to add to their building and all of those things. So that's kind of the approach that we're hoping to take with the school board and to see if they would assist in that.
I do have, did you have your hand up? Sorry. So on the loan that you have with the school, what is the length of that loan? Like how many years was that loan for?
One-year demand.
Yeah, it's a
Oh,
one-year
gotcha,
demand
1
loan.
year. Oh, got it. Okay.
So we're, as you can see in the budget too, we're also awaiting nearly $100,000 in GST from the building of the project. So, you know, we want to obviously,
Of course, they put up a red flag when they saw $100,000 return, so it's kind of in a audit position right now.
it's being audited because it's such a large return. They're trying to see where all of that we've crossed all the Ts and dot all the Is. So
Hoping that it comes out good in case it's just about 100,000. That would help us a lot. Pay down, so we have less interest to pay.
yeah, and all of this is in the interest of putting all of our funds towards lowering the overhead that the debt. So the GST and the Gala funds are all going to go towards paying down the $648,000 overhead.
Oh, Councillor Langridge?
Thank you, Madam Mayor, and thank you to the three of you for coming in and presenting today. Just two questions for me. So I'm going to build off of Madam Mayor's question a little bit. So you have in your budget mortgage and loan payments. How do we come up with that number?
Slide this over here.
The 100,000 is just, I was hoping we get, that was, because we had to do this before the gala. We were hoping for $100,000, so that's just gala funds. The 32,000 and some is the interest we pay per year.
Okay, so but the 100,000 you said is related to the,
To the gala, like what we made at the gala. When I made the budget, that's what our goal was 100,000. We made 142, so.
so it's not 100,000 that's being demanded or you have contractually have to pay. That's what you guys are
No.
hoping to pay off.
Yeah,
each
we
year.
have to pay the 32.
Yes, the 100,
Yeah,
but not
but the 100 was what we were gonna put
Is-
down,
is what you're
hoping to
shooting
put
for.
down as against the capital.
Okay, and my second question is, so just looking through the budget again here, you see a shortfall of 47,641.50. Now, that's without any funding from the town or the MD, correct? So, because I don't see that proposed in here.
There's one, the $5,000 that got operational grant, that's from the MD.
Okay,
Because that's where they've slotted us, because they've got these different
yeah, different streams for sure.
streams, and they've put us there. We have to wait a year before we can ask to be put higher, because 5,000 is the lowest, so I've got that in there,
Gotcha,
because I've applied for there too, and
okay.
that's
So
probably,
if you were to receive obviously the same from both, then you'd have a surplus of about $42,000.
yes, then we
you're saying.
could, yeah.
Okay. All right, thank you very much.
No other questions? No? All right. Thank you so much for your time. I appreciate you being here and look forward to enjoying one of the shows.
Thank you very much.
Okay, thanks.
You know, we'll see you Friday.
Okay, next, Aurora Visual Arts Association. Good afternoon.
Hello.
Hello.
Good afternoon, Madam President and council members.
Hello.
Some strange new faces here that I haven't seen before.
I'm Brenda Claude, and this is
Marilyn Rockoff.
and we represent the Aurora Visual Arts Association. And I know following the theatrical arts, we sound like kind of a little mom and pop group. But all of the paintings that you see here are some of our members. And we have been incorporated as a nonprofit society for 15 plus years. And we have never had a home. We're homeless. But
We do rent.
we've been partnering with the Bonnyville Museum, which has worked out quite well. We pay them rent and collaborate a little bit with them, but not a lot. And we don't have a lot of places to display our works, sell our works, that kind of thing. The Bonnyville Ag Society has been very good about giving us space for like
Art show.
our art show and things. And we're continuing just trying to build a group. And we have young and old. Currently, we have a young member that is doing 2 days a week drop-in. And we have a lot of supplies that were actually donated to us. And we have our own supplies. And so we're hoping through that we'll get more interest.
We have also started a youth art group
Yeah.
through our club from 13 to 18-year-olds to try and help the youth in Bonnyville, MD, and the town of Bonnyville to come.
So our ask is very menial. I think you see it up there. We're basically asking help with the rent and our insurance. This year, next year. We were very fortunate to get an event loan through Alberta Foundation for the Arts. And I'll let Marilyn tell you about that.
This has given us, we've got the ability now to do 20 workshops this year from now till the end of June. Actually, this coming weekend, we have a workshop. An artist from Edmonton is coming in, and she is doing a pastel. Now, because of the grant, we are able to have a very low fee. We're only asking $35 from people to come and take these workshops. We have
Including supplies.
yeah, and that also includes all supplies. The Foundation of the Arts is paying the artists the balance. Some of these artists, they want $85 a student, so it can work up to $800. They're coming from Edmonton and St. Paul. The ones from Edmonton, they want to stay in a motel, so we're picking up that tab. We're also picking up for the gas, and the foundation will be, that grant will be paying into that. We are bringing artist that does sculpture at the end of the month. He's doing a head sculpture. He's going to teach us. Anybody want to come? It's only $35. And we've got oil, and we got lino, fabric art, all lined up. And we got them coming from Edmonton and St. Paul.
And many of our own group are teaching some of these.
Yeah. And
whatever your expertise is.
And also we will be, in March, we'll be putting on a art show and sale. And in that, we have judges come. And we've had artists come from Lac-La-Biche last year. And we hope to have it bigger this year. Last year, we ended up small because we were, the Vermilion artists that wanted to come, they couldn't because it was their show also.
Bad time.
Yeah, it was bad timing, so we've changed our date to March. And that's about it.
And hearing all of those big numbers and big action and big things, we maybe should look more at corporate sponsorship, which we haven't. And, we did try to partner with Bellamy for years, actually, since they started building, thinking the visual arts would totally go hand in hand with this plan, but there's no space, and it never did partner. So, like I say, this year we're looking for our rent and insurance, which is like
It's
$2,700. Yeah.
Thank you, thank
Are
you.
we easy or what?
Yes, you guys are amazing.
But
Thank
it's
you.
only because we have the operational grant through the Alberta Foundation for the Arts,
Yeah.
you know, to get programming and, you know, we're kind of small potatoes.
Yeah. Sorry, so can you clarify again? You have space at the museum and you have to pay rent there?
We rent a room.
Yes.
Oh, okay.
Our
And
room.
for these classes, we have to find a venue.
That
So
was going
like,
to be my next question.
Yes.
Where are you holding the workshops?
right now, I have booked the neighborhood in the Alberta room.
Mm-hmm.
I haven't been able to get hold of Corey. He's been pretty busy, I guess,
The
so.
Bonnyville Ag Society has been good. Like,
Yeah.
you know, they'll give us some space, but as the months go on and we see how many are in each workshop, it will depend.
Yeah, like this workshop this weekend, it'll be at the Bonnyville Museum. We have the room for it.
If it's a
The one
small,
for the sculpture, we have to go to the Alberta room at the neighborhood inn because there's quite a few people.
and you need a table per person or something.
Yes.
Yeah.
Yeah.
Yeah, I certainly could see where there'd be room to collaborate with other organization. If it's something with the youth, maybe the
Yeah,
Hive,
yeah.
they have a lot of space. Then, you know, you can also bring a lot of the youth as well, and they might be exposed to, you know,
Well, we're hoping-
furthering their career in the arts.
This drop-in thing, I mean, and it's free for kids to come, I think Monday after, or Sunday afternoon,
Sunday from one till 3.
and then at
And
one
then-
evening a week.
yeah,
We have
Thurs- I
a
believe
member
it's
that's kind
Thursday.
of taken that on to open the doors. And like I say, we've been very fortunate that we've had a lot of donations. And that's mostly from
And
artists.
even our artists, we all donate also to the club.
Yeah, we do.
Everything that we sell, we give a percentage back to the club also. So if you buy a painting.
Yeah, yeah.
Support the
Support
arts.
by, good, good.
Yeah.
Any questions from council for our group? Councillor Johnson?
Thank you very much for the presentation. I look forward to you guys' presentation every year. It's a lot of fun, so. I'm on the museum board. I serve on the museum board as part of my commitment with
Right.
council. And I really like the synergy, having the art there for when we have visitors come into town. It's a great display that's in the main building. I'm usually there every day right now dumping humidifiers, so I get a chance to visit and see them. And I was actually in there one day when they were doing a drop-in and they were
Yeah.
trying to get me to stay, but unfortunately my artist expertise is stick figures and they're terrible, so
No.
I politely declined. So the one thing you did mention about display space for selling your stuff, have you ever talked with the C2? Because I know there's spots
Oh, yes.
upstairs there
There's
too.
lots.
Yeah.
You're very welcome to hang your things. You are not welcome to sell.
You can't put a price,
Oh, okay.
you can't sell.
And we, you know, different artists, we've had our stuff up there many
Yes.
times, and it's a beautiful space up along the top of the C2. But they definitely will not allow us to put prices on.
Okay, gotcha. Thank you.
Any other questions? No? All right. Thank you so much
Okay,
for your
thank
time this
you. So
So
afternoon.
who's signing up for the classes?
I'm with Byron, not a creative bone in my body. No.
You'd be surprised, you use a paintbrush, I can't draw very good, but use a paintbrush and you can
Yeah.
sure change things. Thank you very much.
Thank you. Okay, gear grabbers. Good afternoon. How are you, Greg?
Good, good.
All right. Good afternoon. Welcome. The floor is yours.
Thank you. Good afternoon, Mayor and Council. Great to be here. So once again, we had a very exciting event out at the airport. Lots of people, lots of noise, lots of smoke, but lots of smiling faces. That's what we're trying to bring to the community, right? Is an event that is different than some of the ones that we've talked about here earlier today. And we try to get the families out and make sure that it's a very affordable event to get out to and that they get immersed into. So this year we had a team out that were very engaging. So the driver of the funny car was actually a female. And she would take little girls and she would put them in the seat and, you know, maybe throw a helmet on them or whatever. And like, you couldn't believe the smiles that were being generated there. So it's fun. It's a lot of work. The logistics to turn that airport into something else is quite a bit. The MD is very helpful in getting that done. I think they're cutting for like a week straight to make sure it all looks good. But we want to thank you for your previous support. Again, we're only asking for $5,000, not 6 or more. But we are very blessed to have a lot of local sponsors, businesses that have stepped up from all over. And that helps us put it on. But I think it was the initial photo. It shows our group of volunteers. Like, these guys and gals work endlessly all weekend long. And we have a lot of meetings during the year to get it going. But yeah, that's the group. They get all the credit there for that. But we're also involved with a lot of other nonprofits who are out to also raise funds. And the SPCA has been with us since our first event. And they do a great job. And we like to make sure we're going to work with something in regards to dogs next year. We did have an issue with dog poop. So we've got to do something about that. We're going to work with them. On the photos, the third one, I think it is. All right, second one is good. Water barriers you see there, we went to those versus using concrete barriers. A little bit more to set them up, but we don't have to use heavy equipment. The runway, you may not know, is old, and it's starting to get pretty crumbly, and so we don't want to operate any heavy equipment out there. And so we purchased those just to try and alleviate any damage to the airport. Again, working with the airport, it has come up a question about medevacs and stuff. And so this year, when we were actually setting up for the event, we delayed setting up to allow a medevac to come in. And this was part of the discussion right from the very beginning, you know, about shutting down an airport. And you know what, if there wasn't any alternatives, we wouldn't have even looked at it. But Cold Lake is open and close, right? So, and of course, anything serious, it goes out by stars. And we do talk to the hospital ahead of time to make sure that they know. What else? We had a big car show, over 250 cars. We had them stretched out all the way to Highway 41, and cars were slowing down on the highway, unfortunately. And you know, we didn't have any accidents out there, but it worked out well. Good turnout there, and again, that one's free to the community. I'm going to let Willie talk about something that was pretty exciting this year, the Wrench Warriors.
All right, so this year we brought in a new initiative with basically introducing the trade to all the youth. So that Wrench Warrior program, we opened it up for youth that are just graduating, so from 18 or 17, whatever, until I think it was 21, I think it was 21 or 23 that we put for a cap. Anybody that was new, that hadn't been involved in the trade already and stuff. So we had nine participants that ended up making it through all their trials, whatever showed up and whatnot to it. So out of that, we hired 2. Actually, I think we brought 3 because there was 3 winners, and we hired 2 of them. Another one went to Browns because they were also Browns Industrial was also in on it with us organizing, and then we actually hired another one. So of the contestants, so we're just again trying to bring more interest and continue next year with it. So it's another stream to introduce them that they're not getting in the schools and stuff like that as well. So got to create people, tradespeople. So yeah, it was successful.
Yeah. I guess that's part of the community engagement that we wanted to get back to with the club, is that it's one thing to put on events, but there should be a bigger picture that we're looking at. And in this case, we saw that there was a need for trades, and these guys, it was their initiative. And when they brought it to us, we said, for sure, we want to be involved. That along with bringing in the the RCMP into the schools. That they came in May and they did their presentations and talked about texting and driving and the dangers in regards to that. We want to continue doing that sort of thing, and we're looking for your input to us if you have any ideas for us to move those forward. With that, any questions?
Excellent. Thank you so much. Council, anybody want to kick it off? Just me? Oh, Councillor Sherman.
Yeah, thank you, Madam Mayor. Just a question or out of curiosity, what is your daily attendance like? I'm sure you guys keep track, and I know, like you can see the parking attendance on the highway and stuff. It's like when you're driving by, it's very well monitored and safety. So just when you see how many, just out of curiosity.
Yeah, in excess of 1,200 on Saturday, and then over 300 participants. So a lot of cars will come with a crew, and so those people are. And we do have some slippage. We know where it is a long boundary there at the airport, and we know we have some people who are slipping in, but those are the ones that the wristbands. That's how many.
Okay, thank you.
Thank you. One of my questions. Okay, I have a few questions.
Okay.
Can you tell us, so the $5,000 for sponsorship, what does that money go towards? To use money for?
So the event usually costs us anywhere from $45,000 to $50,000 to put on, and that's with rental of equipment, costs in regards to just insurance is a big one.
Oh,
yeah. So, and it's always, there's always a lot of questions around insurance every year. In this case, this year we had a 2-seated dragster out there where people actually got to go for a ride, and so there was a lot of back and forth on that one to make sure that we were covered. Yeah.
Okay, and then you talked about, so the gear grabbers bought these water barriers, or what did you call them?
Water barriers.
Oh, okay. Where do you store those?
So right now we were
Somebody's
lucky enough to, no, we were lucky enough, we had Defender Trucking step up, and they are storing them, but they also went down and picked them up for us. So we picked them up at Ritchie Brothers auction for a small portion of what they would cost new. And then we sent a team down there, loaded them up, and they brought them back for us. And we're currently looking at purchasing a trailer from them that is being taken off the road to store them full time.
Oh, okay. Okay, I don't think I have any other questions, but more just comments. You might not want to open the door to things that you might be able to do, because it might put a lot on your team as volunteers, but I think there's always an opportunity to work with the town on how we can expand it. This event just grows every year. You have such a passionate group that comes out for it, and I love how you started incorporating the trades, because those are the groups, you're getting families there and you're getting the kids, so why not incorporate, this is what you can do as a living. I'm sure you're well aware, heavy duty mechanic is hard to come by, so why not get them an opportunity where they can learn about it? So how do you, actually I do have a question, how do you go about finding some of those candidates? Is it just that weekend? And so you talked about you had a couple people who showed up, but what was that whole process and how did you?
So what that is, we worked with, what are they called again? It's Careers. I think it's Careers is what they were called, but, so we worked with them. They put out, most of the initial online applications, everything, and filtered through resumes coming in.
Okay.
So there's certain criteria, right? If they were eligible, if they were graduating, if they can, pass their drug tests, and just your standard criteria to filter down, and then they had to send in a resume. But they took care of most of the filtering of the stuff, and then from there it was just, we wanted fresh people to be able to give them the opportunity, right? So on site we had I think it was 7 stations we ended up setting up. So they had to change oil on a little small engine, do a little technical diagnostics, stuff like that. So it was all just word of mouth. We do need to do a little better better job this year expanding it and doing it a little better online, but it was our first year going into it, so you don't necessarily want 75 people showing up and you're all of a sudden it turns crazy, right? So.
Okay. And is the hopes then at the end that they get employed? Because I think that's what you said,
Yes.
right? You
Yeah.
employed 2 of them?
So there was three winners. We sponsored 3 winner positions, so they got tools for winning. So they got $5,000 in tools for the first place, 4 in second, and 3 for third place, and a year apprenticeship work. So they got a job with tools, basically ready to go. You know, as long as they serve out the year, and then the tools are theirs and everything too out of it, right? So, and that's the idea going forward, is being able to bring on other people to collaborate with around the community. We're not the only ones that have to create technicians or tradespeople. We've discussed potentially even expanding that, maybe outside of just mechanic stuff or whatever, right? Anything that still fits within the realm that's at Gear Grabber's theme and stuff. But so we're working on that, seeing what to expand into.
Love it. That's great. Yeah, definitely an opportunity to even collaborate probably with Portage College.
Yeah, I've been in touch with them a little
Yeah.
bit too.
Good. Okay. I don't have any other questions. Nope. Councillor Johnson.
One quick thing, love your event. It's great for the area. You wanted ideas, maybe? Youth agility test for driving for kids that only have their learners, but they use golf carts on a little thing, and they get points knocked off for knocking over cones and something like that.
Okay.
I don't know, just an idea.
Engagement stuff.
Yeah.
Just depends where we have the grounds, but yeah.
And we could incorporate it into our event.
Yeah.
Okay.
Get some kids out there actually driving, but just a golf cart.
Yes,
and
yes.
Have it regulated, I guess.
Yeah, no.
You don't want to juice that one up. I don't know, just something that popped in my head.
I was at an event last year where I had, there was other mechanics who were adding nitrous to their golf cart and popping wheelies. So
Yeah.
yes, we don't want to.
No, don't let Sean get a hold of it. So, yeah.
Excellent. Well, thank you so much, Greg and William, for being here and presenting, and look forward to the event every year.
You bet. Thank you.
All right, thanks. Okay, now we have the Soccer Association.
Hello, good afternoon. Thank you guys for having us and taking the time to meet with us today. I'm Laura Phillips. I'm the mini director with Bonnyville Soccer.
And I'm Shelby Funk. I'm the fundraising coordinator with Bonnyville Soccer.
So we're here today to talk about our Bonnyville Soccer Mini Wetlands Tournament. This is a key event that we've had in our community for over 15 years. Each year our tournament continues to grow, and we are proud to say it's become a great event in the Lakeland region. Out of all the soccer clubs in our area, we are frequently told that ours is one that everyone looks forward to coming to. We host players from the U7 age to U11 and have welcome teams from across the Lakeland, including Cold Lake, Cuhuan, Elk Point, Lac La Biche, St. Paul, Vermilion, Vegreville, Two Hills, and Sedgwick. Last year, we had the privilege of hosting 68 teams, totaling over 830 players. This is a huge turnout, and every year we see more growth in both participation and community engagement. Each team that comes out gets 3 games to play with other communities. They also get to participate in our skill stations, where players can compete to win prizes for the best shooting, dribbling, or passing. Players also get a hot dog and a juice box and a granola bar to have for their lunch. And the whole tournament is ran by volunteers. We have a committee that we put together, and then we ask our parent volunteers to come out and volunteer for the day. We have over 100 parent volunteers in order to make the tournament happen. The impact of the tournament on Bonnyville is not just in the number of players, but also in the families they bring with them. These 830 players come with parents, siblings, grandparents, friends. On the tournament day, these families are in town for several hours and can spend money on food, gas, and shopping, boosting local businesses and contributing to Bonnyville's economy. We also have a concession stand open for the day, and we also invite local food truck vendors to participate, giving them a great opportunity for exposure and sales. Another highlight of our tournament is we collaborate with Bonnyville Kids Sport. They come out and set up a tent, and we have a pay and kick station where players or adults can come and pay a fee to try to kick at a target and then win prizes. So this not only raises money for kids sport, but it also raises awareness for this vital organization, which helps families across sports in our community.
None of this would be possible without the incredible support from the town of Bonnyville. We want to express our sincere appreciation for everything the town does to help us prepare for this event. We're especially thankful for Sarah and her team who work hard to get the fields and surrounding areas ready with mowing and weed whacking the week before the tournament. We always appreciate the town's help in laying gravel to even out the parking lot, which ensures a smoother experience for all our visitors. On the day of the tournament, we proudly display signs for our sponsors, including one for the town of Bonnyville, to show our gratitude. We also feature our sponsors in a social media post, ensuring they get the recognition they deserve. Our biggest expenses for the tournament are the porta potty rentals, referee payments, and paint for the field. Leading up to the day, we had to paint 14 fields between all the different age groups. The donations from the town goes directly towards these costs.
So in conclusion, the Mini Wetlands Tournament is more than just a soccer event. It's a celebration of community, sportsmanship, and the shared commitment to making Bonnyville a welcoming and vibrant place. The tournament brings together families, supports local businesses, and raises funds for organizations like Bonnyville Kids Sport, all while showcasing our beautiful town to visitors from across the region. We truly appreciate all the support from the town of Bonnyville, and we look forward to another successful year of the Mini Wetlands Tournament in June 2026. Thank you. Do you have any questions?
Thank you. Council? Councilor Kushner?
Thanks, Madam Mayor. Thank you for the presentation. I don't know if you're aware or not, but Recreation here in town, we're changing the Festival of Trees, where everything's gonna be going towards youth. And so basically you get $500. I don't know if you've heard this. You get seed money. And yeah. I know that you're always summertime, but this would, like, I see bottle drives, I see other things that you guys do here. This might be a real good opportunity for individual teams even to put their booth together. You get $500 from the town, and then you sell whatever you want to sell, and you keep all the profits, plus the $500. So it's something that maybe you want to look at, even individual teams, even for something like this, if you need extra money. I think it's a great initiative, and I think we can grow that as we go here as well. So something to look at.
Thank you for that information.
Yeah, you bet.
Thank you. Questions or comments? No. Yeah, I don't really have any questions, but I mean, I think we are more appreciative of you and your team. We see this tournament, and we've seen how it's grown just exponentially over the years. You are now going into like both school fields, and the people that it draws to the community. No doubt, we notice that, and that doesn't happen, you know, just with the snap of a finger. It's because of the hard work and dedication of your guys' volunteers and your organization. So we are the ones who thank you for doing that for our community. You know, it turns out to be such a busy weekend.
Yes, there's a lot that's
There
going on
was
that
a
weekend
couple
in
things
town.
going on that weekend.
Yeah.
It drew a lot of people in,
Yeah.
and I think it's just so amazing when we see that. And
Mhm.
so I don't have any specific questions, but I really want you to know how much we appreciate all the work that you guys do.
Thank you very much.
All right. Yeah.
Okay.
Thank you.
Thanks, guys. All right. Have a good day.
Okay. All right, council, that is all. We'll look for a motion to adjourn, and then we can